Good morning. It is an absolute honor to introduce my good friend and colleague, Ms.Zubeda Mahomed. Ms. Zubeda works for the Quality Management Department and is a very active member in the VTE committee, whose charges extend to policy review, awareness activities, and management of VTE at KFMC. Please welcome Ms. Zubeda Mahomed.
Good morning. It's not easy when you're presenting someone else and when you need to speak for 20 minutes, so just bear with me. We're going to look at VTE from a different angle, which is basically King Fahd Medical City's history, a little bit of background into our experience with VTE, as well as introducing quality in order to make sure that VTE is a success. So we're going to have an overview, like I said, and to mention what is the importance with the regulatory body, which is SIBAHI, regarding VTE, looking at how to use improvement methodologies to make VTE the success. World Thrombosis Day, which was celebrated at King Fahd Medical City, Train the Trainer activity, which we've accomplished, Quality Day, lessons learned, and our message to others. So an overview. To date, there's been very few studies documenting VTE prophylaxis in Saudi Arabia, the most important one being at King Fahd General Hospital in Jeddah. Now, the mortality rates and morbidity rates related to that, as you can see, 31% and 3.1% respectively for patients who did not receive as compared to patients who did receive. And VTE remains to be the leading preventable cause of death in hospitalized patients. So with knowing this and all the information that our respected speakers are giving to you in terms of the medical side of it, if there's something we can do to bring out the best outcomes for patients that come through our doors, we need to be able to do that. As simple as saying a motorist who is either driving the vehicle or passengers who are there, a simple task of putting on your safety belt ensures a better outcome in the case of any adversity. Likewise, patients coming in need to be assessed, and we have the assessment guidelines. KFMC has implemented these VTE prophylaxis guidelines since 2010. However, we lacked data about our own patient population related to VTE prophylaxis screening and the prophylaxis guidelines being implemented. We're looking at the appropriateness of completion. We have guidelines in place, but has it been since 2010 that we've appropriately completed these guidelines? So the multidisciplinary VTE committee, which is here at KFMC, it's a citywide committee, has initiated a project to try and explore the compliance to VTE prophylaxis at KFMC. Compared with previous studies, this study was aimed at providing us with data that will help to see the VTE prophylaxis after implementation of risk assessment model and the mandatory VTE prophylaxis sheet at KFMC. So in terms of the importance, SIBAHI has just been around. We've had our external mock survey, and it's good to know that they have placed importance in making VTE an ESR. ESR meaning an essential safety requirement, without passing which you cannot pass your accreditation. Right? So you need to understand that a selected group of standards marked with this symbol here, an ESR, is what guides us into knowing the essential safety requirements. In the provision of care chapter, it states clearly that patients at risk for developing VTE are identified, the important things, identified and managed. Right? So improvement methodologies, for those who are not aware of the quality concepts, focus PDCA methodology, something that is easy to use, tried and tested, and works well. So we all understand why improvement and focus on excellence is important. What we need is a method. So in using the focus PDCA, you find an opportunity. You organize your team, you clarify your current process, understand the process, and select some desired outcomes. PDCA basically is the plan, the do, the check, and the act phases. So in finding an opportunity, the project will offer further insight into the measure of healthcare safety and quality, and where the KFMC policy systems, clinical knowledge, and prescribing behavior regarding the VTE prophylaxis needs to be addressed. The aim was to identify the percentage of patients at risk of VTE admitted at KFMC and to assess the rate of appropriateness to the VTE prophylaxis guidelines according to the ACCP guidelines. Our team, as you can see, is a multidisciplinary team, and as most speakers have stressed, the multidisciplinary approach towards VTE is the best way to go. Clarifying the process basically identifies what is our current process, and as you can see, a patient is admitted, we have history and physical examination by a physician. What we had in place was the VTE risk scoring was completed by the nurse. The VTE prophylaxis selection was completed by the physician. If prophylaxis was needed, it was prescribed, nurse administers, patient receives. If there was contraindication, obviously the opposite choice or the alternative choice was used, and patient again, at the end, receiving the appropriate. So is there a problem in the current system? Well, in understanding this process, there's many things. Fragmentation in the roles and process stated in the policy, meaning we have the person who is taking history and physical is your physician. The one who identifies the risk factors is the physician. However, the one who's completing the assessment form was your nurse. So a lot of risk scoring was underscored. You have lack of policy enforcement since the time the guidelines was initiated. We've had lack of patient engagement, which was mentioned in the policy, lack of use of the risk assessment, lack of continuous education to our healthcare providers and patients. The VTE forms were not always available, lack of electronic alerts. And this is one important thing that we believe would be the ideal way to move with healthcare, is to have it electronically available at the admission. So selecting your desired outcomes, we had to complete the first cross-sectional study at KFMC related to the implementation of appropriate interventions and the implementation of appropriate interventions by December 2016. Our project goals was to review the current policy, to develop a tool for the antenatal and our postnatal population. We were to perform a KFMC cross-sectional study to promote education and awareness, to improve on the multifaceted, multidisciplinary approach towards patient care, to encourage the patient and family in the VTE management, to establish a system of reporting hospital-acquired VTEs, and to develop an electronic portal for further audits. The plan includes setting ourselves timelines, and in order to do this, as you can see, we have completed many of these timelines related to the goals that I've mentioned in the previous slide. So when you're doing basically is the implementation to revise the CPP and to implement the new forms. World Thrombosis Day was held on the 13th of October, which was our affiliation as KFMC to the World Thrombosis Day. The first cross-sectional study was performed, train the trainer activity. So what we did was our postgraduate department was very helpful in having all their chief residents and fellows to attend a train the trainer session, and they were to take the message of the policy revision and the new forms back to their areas. And we've developed the VTE portal for further auditing, as well as the VTE committee will stay and remain for all hospital-acquired VTEs to be reported to this committee. Highlights from our Awareness Day, the lighter side of it, we had our commitment, as you can see, Dr. Mashira Inani, support from our higher administration for the event. We had multidisciplinary booths. Our vascular team was also part of it. We had nursing involvement, dentistry. That's our Dr. Dr.sheef, who completed the Train the Trainer activity as well. We had the stockings. The stockings is an activity that is done to promote activities during the Thrombosis Day, and this was successful. We also had, this is actually a physician who's also very talented with art, so we decided to use art in our Awareness Day, and as you can see, beautiful painting related to VTE was completed by her. Train the Trainer session, as you can see, our follow-up with our chief residents, we've managed to complete at least 80% of all areas at KFMC since October when the Train the Trainer session was completed. These are some of the data that was received from the study. We managed to get demographic data related to our patients. We managed to get main causes of hospitalization amongst medical patients. And as you can see, cancer is the leading one here. Also, for surgical patients, we were able to get data. We have main risk factors for venous thromboembolism in our study population. A lot of it is related to the chronic bed-bound patients. Our patients at risk, 75% of our patients at risk, then we broke it down into the medical and surgical. We are able to identify the hemorrhagic risk factors during hospitalization from the 352 patients that were in the study. Mobility of the patients was also assessed. Our timing of prophylaxis, our medical versus surgical patients. How does the study help us? We wanted to first start off with, is the form which is in place? When CBAHI or any of the accreditation bodies come to our organization, it's not going to be an individual assessment of a physician to see whether he or she is doing the VTE. They will look at the medical records in order to find the evidence that we have assessed our patients, and the evidence is in the documentation. So is our form currently being completed? 54% only appropriately completed. So when we see 54% appropriately completed, the study is the reason that prompted us to revise the policy and to do the awareness, because as you can see, there's a lot of problems with the risk scoring. We have underscored 23.4%, overscored 2.6, 1.2 not done at all in these files. Prophylaxis selection, which is done by your physicians, we have not done 22.8%, and under prophylaxis 8.4, 1.2 over prophylaxis. Our lessons learned from this activity, which was related to VTE and quality embedded in it, is that several essential elements are needed to achieve a meaningful improvement and sustainability in VTE prevention. These include an empowered multidisciplinary team supported by the organization to standardize our processes, to monitor and measure VTE processes and outcomes, to implement the organizational policies, and above all, to educate our providers and our patients, while VTE sometimes occurs despite the best available prophylaxis. There are many lost opportunities to optimize our prophylaxis and reduce the VTE risk factors in virtually every hospital, hence the need for quality improvement measures. Always said that we can go, if you want to go fast, go alone, an African proverb, and I'm proudly from Africa too. So if you want to go far, go together. Our multidisciplinary team included medical students, quality representatives, health educators, nurses, clinical pharmacists, and led by the chairperson of the VTE committee. Quality Day 2016 was the highlight of our year, and from Quality Management Department, it was a total honor to receive all the quality improvements, and one of them was the VTE prophylaxis. Our theme for the year was effective communication. This was the presented quality poster for 2016 related to VTE, and it was awarded the third prize. Some of the highlights included, we had Miriam, our artist and physician, present again. Third prize that was awarded, and that was the team for the multidisciplinary VTE. Our message to all is identifying why your past efforts have failed to produce the desired results, as this will help us to guide current efforts and avoid repeating the same mistakes, thereby sustaining our quality improvements towards patient safety and achieving a VTE-free hospital. Prevention of VTE should remain a key patient safety priority. Our message to you is to help us in making KFMC a VTE-free hospital. Watch the space. There's a movie coming up. So 2017, we're hoping to have the first video made at KFMC, and it's going to be on all the patient channels related to educating our patients and family so that their engagement in VTE prevention helps our team and our efforts. Thank you.